Welcome to The Heart of Health Live. There's a place for modern medicine in your life. Learn to use it correctly by getting your toughest questions answered on today's broadcast. Discover modern medicine's strengths and weaknesses. Lifestyle medicine opens the door to optimum health and healing. How you live and what you eat can profoundly affect mind and body. Learn simple solutions to complex problems. God provides the ultimate healing we all desire. He wants us healthy and happy. We just need to understand His plan for our lives and live accordingly. And now, live from Studio 1A in Chattanooga, Tennessee, here's your Heart of Health host, Dr. James Markham.
Welcome, everyone. I'm so glad you took time out of your busy schedule to join us. I know you could be doing a lot of other things, but I want to introduce our program. I think it's going to be very worthwhile for you to stay with us. We're going to be talking about hospice care. And Dr. Terry Melvin, an expert in the field, is here to join us, and she's going to answer your questions. And the way you can get on the program, where you're the program, is give us a call. Our number is 855-644-3278, and our call operators are there waiting your call where you can ask a question of Dr. Melvin. She's going to answer it right here. She's not going to send you a bill. And at Heart of Health, we don't have gimmicks. We don't sell products. We just give good information. We want to help you to have a better and more rewarding life. Now, one of the things, a lot of people don't even know what hospice is. Well, hospice involves taking care of people at the end of life. And I think it's so important to have this type of healing. You know, medicines often just treat symptoms. They don't fix problems. But at the end of life, lots of people need healing. That healing might come from getting relationships right. It might be getting your relationship with God right. There's many different ways you can have healing. So we're going to talk about this, and I found out so many people have questions. You know, what is hospice? You know, can you do this? Can you do that? Well, tonight we're going to have those questions answered. You can also join us on our Facebook page and be one of our friends if you want. If you're too shy to ask a question on air, you can leave your question and we'll get to it during our program this evening. Another thing you might want to do is go and visit our website where you can leave your question there, and that address is heartwiseministries.org. Now, you have just a few seconds here when we go to break to get a glass of water, go to the bathroom, get a drink, and then after we come back, we're going to talk with Dr. Terry Melvin, introduce her, and we're hoping you'll have some questions in for us by then. Stay with us. You're watching Heart of Health Live.
The Heart of Health Live will return in just a moment.
The Heart of Health Live is brought to you by Heartwise Ministries.
Hello, I'm Dr. Tim Jennings with your Mental Health Minutes. Are you pregnant or thinking of becoming pregnant? Do you want to ensure your child will have the healthiest brain possible? Then avoid all alcohol, because as little as 1 glass of wine per week alters brain development and is associated with behavior and emotion problems. Avoid smoking. Children born to mothers who smoked had higher rates of learning and behavior problems and psychotic disorders. Take omega-3 fatty acids. Omega-3s promote healthy brains and higher IQ. And watch out for depression. Untreated depression is associated with delayed fetal growth and altered brain development. However, antidepressants can increase miscarriage rates, contribute to smaller fetal heads, and slow growth in the newborn. If depressed, consider transcranial magnetic stimulation, the only FDA-cleared, drug-free treatment for depression with no risk to the fetus. To be smart requires a healthy brain, so be smart, do right, and make your child bright.
To learn more about mental health, visit comeandreason.com.
My life is full of statistics. Thing is, I could have dropped out of school and become one myself, but I didn't, because I had people that believed in me. Here's another statistic. 7,000 students drop out every school day. That's 1 every 26 seconds. It's time that students know that we believe in them.
Inspire a student and share your message of support at boostup.org.
Imagine a classroom with no boundaries. A classroom where reenacting a book is an English class, and repairing a motor is a math lesson. A classroom where caring for horses is biology. This is our classroom. At Bachman Academy, 6th to 12th graders with ADHD, dyslexia, and other language-based learning differences are provided a language-rich, hands-on program of study. With an average of 5 students per teacher, Bachman students receive more attention and have more time to learn while using their own learning strengths. Now, imagine your child in this classroom. To learn more about Bachman Academy, visit our website at www.bachmanacademy.org. Bachman Academy, tapping potential one person at a time.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back. I'm Dr. James Markham, and you're watching Heart of Health Live, where you're the program. Tonight, we're talking about healing at the end of life, and we have a specialist, Dr. Terry Melvin. She works for the Chattanooga, Chattanooga, what would you say?
Hospice of Chattanooga.
Hospice of Chattanooga. I wanted to say it right. And Dr. Melvin, thank you for joining us.
Oh, thank you for having me.
Now tell me, what got you interested in practicing this type of medicine and healing?
I was supposed to do this.
Okay, how did you know that?
I actually did my I did my residency in fellowship.
Mm-hmm.
Let me back up. Internal medicine, geriatrics fellowship.
Okay.
And while doing the fellowship in geriatrics, there was a hospice and palliative medicine component. And it was just the coat that felt right. It was something that's what I was supposed to do. And it is something that is very important and very passionate to me. I feel that people need as much attention and care at the end of life as they do at birth. Lots of magical things happen, lots of healing, lots of unresolved issues resolved. People can change. Sometimes they don't, but they can.
Right.
They can.
And you actually see patients every day?
Every day.
Okay. And, you know, I tell people that there's more to healing than the physical self.
Oh, absolutely.
And I think in modern medicine, sometimes we're trained, we miss that boat.
The one thing about hospice care is it's not just the physical. We look at the emotional, the spiritual aspects. We look at the psychosocial aspects of the illness. It's that particular person's disease, but it's our illness. It impacts all of us.
Right. So you've got lots of experience doing this with people from all sorts of walks, I guess?
Yes.
Okay, well we have some questions before our callers call in. If you want to join us, it's 855-644-3278. But this one came in from our website, and the question is, it says, my dad is very sick. What is the process of having hospice help care for him?
Yeah. We need to have a referral usually from the physician. So if you would call your primary care doc or the doc that saw your dad last and just let them know what you're seeing, and if they would call in a referral to hospice so that someone from hospice would come out and do an evaluation to help you care for your dad.
Now, does it just have to be a terminal illness?
It's an illness where if the disease continues, that person have a life expectancy of a year or less.
Okay.
Yes.
Okay, and I guess that would be determined by the attending physician?
The attending along with the medical director of the hospice.
Okay. So, you know, what the process, so they would get their attending physician. What would be the next thing that would happen?
Someone from that hospice would then call the person back, the caregiver back, and make an appointment to come out and visit with them.
Now, do you usually talk to the person themselves or the family, or?
We talk to either way.
Okay.
Usually not any one person lives in a box by themselves, so we talk to the whole unit.
Okay.
So it's usually the patient and their family members that are involved in their care.
You know, and sometimes that can be very emotional, can't it?
It is emotional. It's because we are seeing the change, we're experiencing the change, but we really haven't called it what we see for fear of what that might mean.
Right.
And we just help people get to that particular point.
So I guess that first visit, you're really not sure exactly what's going to happen.
Absolutely not.
Or what's been said, or
Absolutely
what the expectations are.
That's
so.
right. That's right. It's challenging. It's frightening, not just for the patient and the family, because they may hear something that they're not ready to hear, or they may hear something that they're in their hearts they see, but they just don't want to acknowledge it yet.
You know what's so sad for me is I work as a cardiologist, and I frequently see patients come in and out to the hospital numerous times, and we know that they don't have much time left, but the things that need to be said, the healing that needs to be done, the relationships with each other, as well as making sure everything's right with God, sometimes in the process of the disease and the technology, we miss out on that.
Yeah, and what we do is we call that elephant out in the room.
Yeah.
You know.
So I think, I think everyone should be considered, almost everyone that you can, to be involved in hospice care. And I also think it would be not only great healing for the patients and families, but it also helped the nation out as well.
Yeah, I think that a lot of people have this misconcept of hospice, and that, when hospice comes in, that means that I'm knocking on death's door.
Right.
And that's not necessarily the case. Or that I can't get IV fluids, or I can't get blood, or I can't go back in and see my physician. And none of that's true. It is the patient and the family that will dictate that plan of care. Right. They will say, this is what I want. And then we put systems in place for that to occur.
Wow. And it's not just one person. You have a whole team of people
We
helping?
have a team of people. We have volunteers. We have someone from chaplaincy. We have nurses, we have CNAs, we have pharmacists, social workers, physicians.
Everybody.
Yeah.
Well, my first introduction to hospice was when I was a student at the University of Texas. And I was wanting to do something volunteering, and it was Hospice of Austin. That's where we went, Austin, Texas. And I went to a training course where they would train you how to do things with the families. And my job was mainly to sit with the families and just to be there, the ministry of presence. I was too shy, I didn't say much, but I was just there. And if they wanted to say something or do something, I would listen.
That being present is really hard. Just to be, just to sit, just to not do anything but be is very hard. Sometimes family says, we have to do something. Well, we are doing something.
Yeah, and so I call it the ministry of presence. Just being there is doing something.
Yep.
So that's sort of, his dad's very sick. That's sort of the process. I think that answered that question pretty good about, the contact the attending physician, then the attending physician contacts you.
Right.
And then the team comes out there and assesses.
Right.
Okay.
That is correct.
Now, families always interested. Does this process cost money, or do you have to pay for this, or?
It is a Medicare Part A program, so it's covered 100% under Medicare Part A. Most insurance companies have a hospice program. TennCare has a hospice component.
Okay.
For those that have no insurance, we do have a sliding fee scale.
Okay. Now, many of our listeners today might not even be in our country, so some of these might not even have hospice programs. So I guess something could be arranged to their churches or volunteers, or?
Most places in the world have hospice.
Okay.
I know that we've worked with Africa through the NHPCO, the National Hospice and Palliative Care Organization. Europe is where it started with Dame Cicely Saunders. We're working in China and Asia to have programs developed.
It's a worldwide program.
Yes, it is.
Well, we're going to go back to break, and I want everyone, don't be afraid to call. I know this is a subject that a lot of people don't like to talk about, but it's very important, and your question is very important to us, and we can keep your name secret if you want to. Give us a call, 855-644-3278, and we're going to be right back with Dr. Terry Melvin answering your questions specifically about care at the end of life. Stay with us.
The Heart of Health Live will return in just a moment.
I'm Dr. James Markham, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
I'd like to think that one day, when we get to heaven, we're going to see a list of people like Jared and Susan, who were introduced to Jesus because of something we said. Or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program. But we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the tree of life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
We've been talking about care at the end of life with Dr. Terry Melvin. I think that first question was very good. A lot of people don't know how to get involved, but I think that was laid out very clear. Our next question is, can a person in the hospital, someone that's admitted in the hospital, receive hospice services? So if they're in the hospital, can you still come in there?
Yep, we can.
How does that process work?
They will call, the hospital usually calls us. Our goal is to find out what the plan and the goal for the patient and the family is.
Okay.
And there are times when going home isn't attainable.
Okay.
And so we provide that end-of-life care with the staff and our staff in the acute care setting.
Okay. Now, is there special facilities that you can arrange that at, or do they stay at the hospital? Or?
They will stay at the hospital,
Okay.
or we do have a 16-bed at the Hospice of Chattanooga inpatient unit,
Okay.
which is a home away from home.
Okay.
We have nurses, social workers, CNAs, staffed around the clock. Physicians are there every day, seeing patients and families.
Now, is that a service that many of your people utilize, or is that something that not too many people use?
We have over 400 patients, and probably 5% of them may utilize it.
Okay, well that's nice to have that option, because
Yes.
not everyone can go home, and for some, home might not be optimal either.
And we have patients that will get a referral from Vanderbilt.
Okay.
And they're so sick and they have so many things going on. They have declined so quickly that going home is a little overwhelming.
Right.
And so we'll go to the center and try to get things a little bit more simplified, explain where the patient is in their disease process, and then help families so they understand what to expect next.
Yeah, I like that phrase, help families, because I read a statistics not long ago that when a loved one passes away. If you're not ready for that, it puts a lot of stress on the body. You know, the adrenaline, the cortisol, and someone that could be really perfectly healthy because of this overwhelming stress response. You know, we have a condition in the heart called the apical ballooning broken heart syndrome. We've seen heart attacks after that. So it sounds like you're not only treating the patient, but you're also treating the entire family.
Yeah, yeah. I mean, it's not just the one. It's his or her disease. It's our illness, and we try to approach that whole unit.
And I think it needs a specialty part of medicine, because most physicians, you know, it's hard for me when losing someone, you know, to go through the steps. So it's helpful to have someone that's been there, done that, knows what to do and say and how to relate to the situation. Because not all, we're trained to keep people going.
That's right. That's
you know,
right.
we're not always trained to resolve conflict and help, you know, manage some of the issues that come up at the end of life. Well, that's a great answer. Okay, so a person received hospice services in the hospital? Answer is yes. Okay, our next question that's come into our website. Before I go to this one, don't be afraid to call us, 855-644-3278. If a person is in the care of hospice, okay, can they receive intravenous medications?
Yes.
Intravenous medications.
Yes, yes. Again, it depends on what the illness is, but we can give medicines by mouth. We can give medicines intravenously. We can give medicine subcutaneously, like you would do insulin. And we can give it transdermally. So we can do patches, creams, and then we can give it in the buccal mucosa. So medicines can just be put inside between the cheek and the gum, and it's absorbed without swallowing if someone has problems swallowing.
Now, do you still use aerosol treatments?
We still use aerosol treatments.
Well, I think that's one of the best, because, you know, if you think about it, you know, there's only one layer of cells between the lungs and the blood, and it gets in it probably just as quick as you would get an IV.
Yeah, it's a little quicker.
Yeah, so that's very comfortable for people too.
Yes, yes.
Now, are you using the pain medicines for that, or?
We are using the morphine and the hydromorphone, so pain medicines can be given, especially for those patients who've never been on any opioids. And they're having a little shortness of breath, or they're having more shortness of breath than they are aware of. And so we'll give the aerosol medicine and they feel better. They're not as short of breath. They feel like, I didn't realize how difficult it was to breathe.
So you can really do everything that they do at the hospital.
Correct.
There.
At home.
Right, at home.
Yes.
Wow, that's amazing. So, so they can receive all of that at home. Let's go to another question here, okay? This is a great question. I'm sure a lot of people have that. This is, how do you control pain and breathing problems if patients cannot eat? And I think you answered part of that.
Right. So we can control the pain when they can't swallow, because your esophagus is a muscle just like your quads. So just like you get up and you go to the bathroom and you come back, you get up and you ambulate, point A to point B. That's how the esophagus works. I put something in to swallow. As I get closer to death, I lose energy, and one of the energies I lose is my ability to continuously swallow. So it's not that I have anything wrong with my esophagus other than I'm weak and I don't have the energy. So in order to continue to get medicines, we can do it, like you said, aerosol. We can do it in the buccal mucosa. We can do it subcutaneous. We can do it intravenously. So there are other ways in which we can get your medicines down other than you just swallowing.
Yeah. Now, we've talked a little bit about the medical care. How do they approach the spiritual care? You know, because everyone comes from such different spiritual backgrounds. You know, here at the Heart of Health, you know, we really focus on that relationship with God and letting God sort of take that person, you know, where they need to be at that point in their life. How does your team and the hospice team approach the spiritual issues? I mean, is it something that's brought up, or do you wait till the family brings it up, or how's that handled?
Actually, it's something that we assess on admission. And we asked if there has been kind of look at spirituality in terms of, are we connected, are we disconnected, or are we unconnected? So if we are connected, that connection is with our family, and that's with our immediate family, our community family, our church family. Okay? And we try to make sure that each one of those layers have been touched upon as it relates to this illness and this patient's decline.
Right.
If they are disconnected, so at one time they had been part of something larger than just themselves, we try to reunite them, either with family, community, or spirituality. I'm going to use the word church.
Right.
Okay?
Right.
If they have never been connected, we will try to, we connect them with us. We connect them with our volunteers. We connect them with our chaplains. And we become a part of that family, their extended family.
Well, I think that's wonderful, because you know, I have a lot of people that they don't like to talk about these things. You know, they don't like to admit that they're scared, that they're lonely. They don't really, you know, these are all issues, and unfortunately in our world, you know, we're not taught to communicate about some of these things.
And that's what we are best at.
Yeah, and there's healing that comes when, you know, when people start to relax. You know, your limbic system makes all this adrenaline and cortisol. When you have that peace, you know, there's a relaxing, and sort of their chemistry gets better. Actually, the pain can get better when a person's not stressed.
You know, we always started from pain because that's something that everybody will listen to.
Right.
But it's more than just that physical pain.
Okay, I'm going to stop you right there. We're going to go take a quick break. Give us a call. Our phone number is 855-644-3278. You're watching Heart of Health, and we're answering questions about palliative care, end-of-life, hospice. So stay with us. We're going to be right back answering your questions.
The Heart of Health Live will return in just a moment.
I'm Dr. James Markham with your medical moment. I don't know about you, but I get thirsty if I talk a lot. Well, one of the greatest needs of our body is water. Did you realize that up to 70% of our body is water? All the chemical reactions from the brain to the heart beating to the muscles moving all depend on water. It's one of the most important substances we put in our body. If we get dehydrated, many bad things happen. We can have inflammation, we can have the blood thicken, we can have blood pressure changes, we can even have our heart race. You don't want to be walking around in the desert. Hydrate yourself. How much do you need? Divide your weight in two, that's about how many ounces. Or drink enough water till your urine comes out clean. Remember, water is one of the most important ingredients we put in ourselves every day.
To learn more about your health and discover what Dr. Markham is doing in your area, visit heartwiseministries.org.
Have you ever heard things about God that didn't make sense? Have you ever thought that science and Scripture cannot be reconciled? Have you heard ideas about God that scare you? Or are you just tired and confused? If you want answers to complex problems, if you want a testable, evidence-based understanding of God and the world around you, an understanding in which the Bible and science harmonize to reveal the reality that God is love all the time, then Come and Reason Ministries is for you. Hi, I'm Dr. Tim Jennings, board-certified psychiatrist, and Come and Reason Ministries is dedicated to helping you learn to discern, to stimulate you to think, to help hone and refine your ability to know the right from the wrong, the healthy from the unhealthy, and teach you how to experience healing of your mind, body, and relationships here and now. If you would like an evidence-based approach to knowing God, then visit us online at comeandreason.com.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
We're so glad you've taken the time to join us on Heart of Health Live, where you can answer your questions, and we'll do our best to answer them. We're speaking with Dr. Terry Melvin, and we're glad that she's joined us. She's been giving us great information about hospice, palliative care, and I want everyone out there to think about, you know, this type of healing is just as important for families and communities as anything else. I do want to answer as many questions as we can. This doesn't have to do with hospice, but I can handle this question. This gentleman calls in, he's having his tooth pulled, and that's never fun to have your tooth pulled. He wants to know what is a safe medication to take, okay? Well, you know, unfortunately, there's no medication that's 100% safe, but most of the time, if you're having your tooth pulled, they put a substance called lidocaine in there, and it numbs everything up, and you can have your tooth pulled. If you want some other medicines, if you don't have any big medical problems, you can usually take some Tylenol. That might help. I stay away from some of the non-steroidals if there's a lot of bleeding, but sometimes people can take a non-steroidal Ecotrin or Motrin or something like that might help too. But you know what? If they do a good job numbing it up with lidocaine, take a couple Tylenol after, you're usually going to be okay, and that's usually a pretty safe medical regimen. Now, Dr. Melvin, another question that just come in hot off the press. This person wants to know, is there an age limit for hospice? You know,
No.
can the young, old,
No. We have a perinatal program where we take care of moms and dads of babies that may not make it to term. We have a pediatric program, and so it's everybody can die.
Okay.
And it doesn't have an age limit.
Okay, so you take care of
We
young
take care
and
of
old.
everyone.
Wow, so
Yeah.
it can be 105 or 1 year old.
That's right.
Wow, that's great. Anna, you're on with Dr. Melvin. What's your question?
Hello, thank you for taking my call.
You're welcome.
I have a question regarding the anxiety that a person may go through as they become more terminally ill. And in fact, my sister-in-law, this happened with her. She was had COPD on oxygen, and as she became more ill and her final hospitalization, she had health directives already drawn up, but she chose, without talking to anyone, to take them and tear them up. She seemed to be very concerned about dying, and how do you deal with things like that?
Anxiety is a common feeling that people experience. It comes from them not verbalizing or talking about what some of their fears are. And in your sister's case, it sounds like she was conflicted based upon her advanced directives. Usually it's around fear of how will I die? What will that look like? There may be fear of I'm leaving and I won't be here to see my children or my grandchildren. It may be that I was the breadwinner in the family and I don't know how my family's going to get by. With that said, there are medicines that we can give to help with the anxiety. So we can give short-acting benzodiazepams such as your lorazepam, Valium, and anxiety is a form of depression, especially at the end of life. And so giving a little Buspar or a little SSRI can help with that while we address what's causing the anxiety, because we have to address what's causing the anxiety.
Anything else, Anna?
I know she had a new, yes, thank you. I know she had a new grandchild that she probably wanted to see more of, you know.
Yeah, yeah.
But she was transferred home and had everyone around her, but apparently it was quite difficult in her last days. I wasn't able to go, but my husband went. It was actually his sister.
Okay, okay.
Yes, well, thank you. I think all of us probably want to know more about these kinds of issues as we get older. You know, I think it's a good thing to know.
Yeah. Yeah. Thank you, Anna, for calling. I appreciate your call.
This program.
You're welcome. You're welcome. We're glad you called. Yeah. You know, it's so hard as a culture. You know, I hate to say this, but we're not talking much about things. You know, we do a lot of texting and emailing, and sometimes we don't sit down and talk and find out what the real issues is. Even when you come to the doctor's office, sometimes it's easier to go, here's a pill and, you know, get over it rather than to address the cause.
What I was saying before we went to break is the pain and giving the medicines for the pain is probably one of the easiest things to do. Mm-hmm. The hardest thing is to find out what's underlying that pain, what's underlying that anxiety, and it may be something that happened years ago.
Right.
That we have to allow a safe place so that it can be brought up.
Right. Pam, you're on the air with Dr. Melvin. Go ahead with your question or concern. Pam?
Hello.
Go ahead.
Yes, sir. Can you hear me?
We hear you just fine, Pam. Go ahead.
Okay. I had back surgery. Actually, they went into had to go into my spinal cord, and they took a tumor from my spinal cord as big around as a baseball. And it wasn't cancer. It turned out to be MRSA. And Hospice was coming in and taking care of me. And I had my granddaughter with me. And there was a situation that come up in the apartments, and I had to move out. And right now, I'm pretty much, I'm still seeing my doctor, but I need to see my other doctors. But what is the most important thing, since Hospice told me when I get another apartment that they would come back out and help me? What is the most important thing I can do to help myself right now?
We're going to have to get some more information.
Yeah, we need a little bit more information. Where are you staying now?
I'm in Jeffersonville, Indiana.
Okay. Are you at home?
Yeah.
Okay.
Okay. I think that, are you needing help with dressing changes? Help me.
No. I just don't understand what MRSA really is.
Okay.
Oh, okay.
So MRSA is, it's a staph infection. We all have it on our skin, and it is a little resistant, so it's methicillin resistant. We have to be careful because it becomes then an opportunistic infection that can make us very sick. And so that means that we would need to be on antibiotics. Can you pass this on to someone? Yes. And so we want to use good hand techniques, washing our hands, making sure that our bandages are thrown away, that if we have anything that leaks, that all of that's cleaned up. Mm-hmm. If it leaks on the sheets, we change our sheets. Does that help?
Does alcohol help?
Yeah.
After you bathe.
Hey Pam, if you can hold on just for a few seconds, we're going to go to break, and then we're going to come back, and I want to talk to you some more and ask about, about this condition and why they think it's life-threatening and why it's not treatable. But just stay on the phone with us, and we're going to be right back after this break. You're watching Heart of Health Live. Our phone number 855-644-3278. We'll be right back.
Heart of Health Live will return in just a moment.
Wow, these are really good.
You act surprised. Practice makes perfect.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who don't need perfection. They need you.
Hello, I'm Dr. Tim Jennings with your Mental Health Minutes. Are you pregnant or thinking of becoming pregnant? Do you want to ensure your child will have the healthiest brain possible? Then avoid all alcohol because as little as 1 glass of wine per week alters brain development and is associated with behavior and emotion problems. Avoid smoking. Children born to mothers who smoked had higher rates of learning and behavior problems and psychotic disorders. Take omega-3 fatty acids. Omega-3s promote healthy brains and higher IQ. And watch out for depression. Untreated depression is associated with delayed fetal growth and altered brain development. However, antidepressants can increase miscarriage rates, contribute to smaller fetal heads, and slow growth in the newborn. If depressed, consider transcranial magnetic stimulation, the only FDA-cleared, drug-free treatment for depression with no risk to the fetus. To be smart requires a healthy brain, so be smart, do right, and make your child bright.
To learn more about mental health, visit comeandreason.com.
Hi, I'm Dr. James Markham, Speaker, Director of Heartwise Ministries. And at Heartwise, our goal is to bring people into a relationship with the Heavenly Father using modern medicine and the healing principles found in the Bible. We teach people that there is a place for modern medicine and a healthy lifestyle, but it is in a relationship with their Creator where ultimate healing can occur. Over the past years, our ability to share this message of truth, love, and healing around the world has increased exponentially. But to continue this steady growth, we need your help. We are looking and praying for 100 individuals willing to give $1,000 a year. If the Spirit is moving you to become one of the Heartwise 100, won't you consider donating online today at heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back. I'm glad you're joining us. We're talking with Dr. Terry Melvin with the Hospice of Chattanooga. Dr. Melvin, Pam has left us on the phone, but she left us with some questions. And I guess one of the questions is, let's say you're in hospice and you don't have a terminal disease. Do you have to stay in hospice?
Oh no, we have people that graduate.
But can actually people get better and whoops, wasn't really true, you're doing okay, you're doing better?
Right, or maybe at the time that they were sent to you, they hadn't gotten all of the pathology, all of the information, and it turns out that it's not as bad as they thought, and so we do discharge patients. And with Pam, having the abscess on the spine is not necessarily a terminal illness. Right. It's serious. It needs to be addressed, but it's not something that she would die from in a short time. And so if hospice is not involved, I think that's a good thing. Right. And she might be able to benefit from maybe home health to come in and help her. That's a good idea.
And a good question, and hospice could sort of help that and define something. It sounds like we need some communication.
That's right.
Define what's going on and whether she really has a terminal illness, and if she doesn't, what are her other options?
What are her other options? That's right.
And I guess, I would be afraid if I didn't have other options and I needed care.
Right. Right, and so home health could really go out there and help her.
Maybe that's something that would help out. Well, that's great. I have a question that's coming into our web site, and this is one that I hadn't thought about. What actually happens when someone passes away? So what is how's that all handled?
Yeah, we have been talking with the patients and the patient's family. They have talked about what the patient have wanted, and what kind of services that they would have wanted. Usually they will have a funeral home. So at the time of death, everybody does it different. It depends on what culture you're from. But when the family is ready, we will call the funeral home. The funeral home will pick up the body and take the body back, and that's what happens.
Okay.
Okay.
Now, does hospice still, support the family in the grieving process, or is it?
Yes, we will actually follow the family for 13 months after the death.
Okay. Now, when you say follow, what's that? A phone call or someone visit, or?
We'll make a phone call, a contact within 4 to 6 weeks afterwards, because there's a lot of family in usually. By the 6 weeks, people are going back to their routines. We have open grief groups. We have closed grief groups where we actually physically meet either one-on-one or in a group. We do mail-outs. Okay. We contact them either monthly or quarterly, and it just depends on what their risk was at the time of the death, the caregiver's risk. So if it was a high risk, it's actually more frequently in-person contact. Some of the routine lower ones, it might be a mail out. And then on the anniversary, we also extend calls and then physically get with them.
So it goes on for quite a long time.
It will. And then the first holidays, I mean, those are tough.
Okay. Now, one of the questions that came in is how do I know what is a good hospice and a bad hospice? I didn't know there was bad hospices. But I guess if you're a consumer and you have more than one choice, you know, how would you, let's say, when you're in some other part of the country and there's 3 different companies that come to you that offer hospice cares, how would you help our viewers sort through that?
So there are for-profits and not-for-profit hospices. There is a national organization, which is the National Hospice and Palliative Care Organization. Most good hospices are a part of that national organization. Being a part of that organization states that we have certain standards that we uphold to. Some of the routine hospices that come in are not necessarily working under those same policies that we would expect.
Okay. So they're like, it's sort of like there's certain standards, but everyone doesn't have to meet those standards. But you should ask about those standards.
You should ask, and I think if you go to the NHPCO website, you will see the listing. If you go to CMS website, there's also listings of hospices that are certified, are credentialed, and those that aren't. You also want to ask if they're JACO or CHAP certified.
You know what? Another thing that I like to tell people is ask your friends and neighbors. Ask your physician. Who does he think? Have he worked with them before? Has he had success? But I think that's an important question to answer. Is you have to know who you're dealing with. This is so important
because there's so many different hospices that are popping up. It becomes sometimes frightening to know which one is the best.
Now, over the last few years, as our population is aging, has nationwide, have we found that the incidence of people utilizing hospice has gone up?
Absolutely.
Okay.
Absolutely. I guess 15 years ago we may have had 1,200 hospices, and today we have 3,000 hospices in the country.
Okay.
There are more people utilizing it now than ever. I say that, and I also want to say that our lengths of stay are so short, 14 days. It's very difficult to have people do the work that they need to do at the end of life in 14 days.
Right.
When it is a benefit and it's 6 months.
Right.
So we do enough just to get the pain under control and they're gone. But all those unresolved issues, we never have time to attack.
Wow. Well, I think that's an important point because, the mental pain can be greater than the physical pain.
Absolutely.
And that sometimes takes time. And I guess you have to have some really skilled set of listeners and evaluators.
That's right. That's right.
Now, not everyone gets trained like you that are involved in hospice. Not everyone has degrees in palliative care and have experience. How do you know whether your caregivers are good enough to do this kind of stuff?
We have, for our professional caregivers, we've actually started, it's called the Hartman test. And so it looks at judgment.
Okay.
And so do we have that right judgment? And then we teach them in this particular situation, these are the things that we want to look for. We are a team, and so we come together frequently, and it becomes very easy to see what's needed. We're able to track calls of families and patients.
So, you know, like you just like rounding on a patient. You have a multiple, you know, you round on them, everyone sort of gives their input.
It's more than one person caring for the patient.
It's a team approach.
It is a team.
Okay. Well, I know some people have been shy tonight to call, but you still have a little more time on the watch here. Give us a call, 855-644-3278. Or if you want to have some more confidentiality, you can go to our website, heartwiseministries.org. Does Chattanooga Hospice have a website that they can go to and get answers to some of these questions?
www.hospiceofchattanooga.org.
Okay, well, we'll go over that website again. If you have questions, we still have another segment left. Stay with us. You're watching Heart of Health Live.
The Heart of Health Live will return in just a moment.
I'm Dr. James Markham, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org. There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
I'd like to think that one day, when we get to heaven, we're going to see a list of people. People like Jared and Susan, who were introduced to Jesus because of something we said. Or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program. But we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Well, we're glad you're joining us today on Heart of Health Live. This has been a tough topic to talk about because, Dr. Melvin, it's tough to talk about passing away, but there's a right way to do things. And, you know, I just see it as a transition. You know, it's a transition, and we have to learn how to do it well. And I'm glad that we have specialists like you to help in making this transition. So why don't you tell us, you know, you're talking to a lot of people here, what's on your heart? What would you really want everyone to know regarding what you do on a daily basis? And I know you're so passionate about this.
It's hard. I mean, it's really hard to talk about this, but it's real. And don't wait 2 days. Don't wait. Don't say, that's not what I want, because sometimes doing everything is not the right thing to do.
Right.
Going in and out of the hospital. You don't have enough time going in and out of the hospital to say goodbye to your loved ones, or to get your affairs in order, or to just be. It's a group of people that come and will work with the patients and the families in terms of what they want at the end of their life. We don't focus on dying, we focus on living. We focus on living every day until we transition.
Right.
It's something where you can't help but believe. You can't help but believe.
Yeah.
And sometimes I think people wait till the last minute because they're afraid.
Yeah.
If they don't bring it up, then they don't have to discuss it, then it doesn't happen.
Right.
But it does happen. It's going to happen anyway. So you want to have some control over that.
Yeah. And I like the word dignity too. You know, you want to have dignity. You don't, you know, you want your family to be, you know, if I had little time left, I would rather spend that time with my family than a total stranger with a bunch of pills and a bunch of procedures that doesn't really fix the problems. That's what I would want. And I think that's the message we have to get out as people.
And you have a choice. You have a choice. And you have the right to know how bad you are.
Right. And I think a lot of it, like you said, I do think there's fear involved. You know, and unknown. We don't communicate well. You know, I think it's good for all doctors to communicate, you know, to your patient's true condition. Sometimes we don't really want to let them know.
Right. And if they've been in and out of the hospital, if your loved one's been in and out of the hospital, we need to get off that train.
Right.
Just go stop. What are we doing and what are we looking at? What is it that we're going to expect to see next?
Okay. Dr. Melvin, what's your website again for those that want to learn more?
www.hospiceofchattanooga.org.
Okay, and we want to thank everyone for joining us, and we want you to remember, there's a place for modern medicine, but that doesn't fix everything. There's a place for lifestyle, but it's in that relationship with God and letting God take you to wherever He wants you to be. That's where we can find peace and ultimate healing. And we want to encourage you to sort of look for that relationship in your life. Don't be afraid to ask questions and get answers. We want to thank you for joining us. You can look at our website. It's heartwiseministries.org. You can be one of our Facebook friends. And we want to just wish you the best of health. We want to thank Dr. Melvin for joining us today. It was a pleasure for giving your time. And we're going to be with you this time every week on this local station. So keep joining us. We'll have a different specialist every week answering your questions. Don't forget that phone number. It's 855-344-6278. I'll see you next week.